Hello friends, welcome to Doc and Doc. I am Dr. Vijay Agarwal from Apollo Health and Lifestyle. Friends, as all of us know, health is the most wanted thing these days. The first priority in a person's life is his health. And to keep your body healthy, we need to do certain things. One of them is regular health checkups. Now, we talk a lot about it, but none of us are very clear what exactly it means, what does it include, and how it helps us. So, to answer all these questions, today we have with us an expert on this subject, Dr. Soni. Dr. Soni is a consultant physician with Apollo Health and Lifestyle, and she has more than 20 years of experience in treating lifestyle disorders. So, welcome, Dr. Soni.
Thank you. Thanks for your kind introduction.
Okay, Dr. Soni, as all of us know, health checkups should be done
Yes.
and should be
Yes.
done
Yes.
regularly.
Yes.
So, but from more scientific, from more medical point of view, I want to know what exactly it means, the preventive health checkup, and why it should be done.
Okay. So what now? What we can call it is like a complete body checkup, or we can also say like it's a medical health checkup that includes assessment and detection of early diseases and complete care of individuals in overall health and well-being.
Okay,
And
and why should we do it?
so we should go for this because by doing this we can detect so many critical illness before they manifest in the disease. We can find out many risk factors so which can be addressed, and we can give a recommendation for improve the lifestyle and some suggestions to improve the health.
And what all should be included in this?
So
I mean, what I'll make this question little more elaborate on this question. See, I am a healthy person.
yes,
Okay,
yes,
I do not have any visible symptom of
yeah,
any disease,
yeah.
and I have my father who is having hypertension, or another person in my family who is on some treatment. So, should we have same health checkup for all of us, or it should be different? If it is different,
So
what
yeah,
all it should
yeah.
include
So
for
yeah, I
others?
understood what you want to say. So what if you have family history of like high BP and diabetes in your family, or even some cancers which are running in your family? So we can go and address those reasons and those diagnoses we can do uh, in health checkups. So like breast cancer history is there in the family, so we can go for the breast cancer.
To Sony, we've understood that health checkup is important to diagnose a disease condition before it shows
Many.
visible symptoms. Now, the question is like, what all does it include? I mean, what I want to say is a person who is healthy, a person who is having some disease or on some treatment, like say hypertension, diabetes, or cholesterol. So, how the health checkup for the person who is appearing normal versus a health checkup for a person who is having some condition differ, or what all the additional things should the person have? So,
So actually, we have a lot of packages available in our clinic for the general individuals. But if people are having like history of diabetes history or some other ailments and all, so we can go for particular that part only, or we can go for screening for diabetes and all, and we can detect. Diabetes complications early by doing this, and we should go for frequently HbA1c checkup also if it diabetic history is there. So some like other history like thyroid history is also there. We can screen for thyroid TSH level every 3 months to 6 months. So
so
we
what you
can
want to say is frequency for a normal individual is different than the frequency for
see
a person who is
having risk factors
factor.
and family history or some other lifestyle related disorders already existing in the family. We can address them.
Okay,
Okay.
okay, okay. So, next I wanted to ask this thing only, how frequently we should do it.
Yeah, this is the $1 million question. So actually, generally we are thinking it should go for yearly once and all. But if people are suffering like diabetes, some other chronic ailments, and some other family history is there, they can go as person is needed about So diabetes, they can go for every 3 months. HbA1c checkup also they can do. TSH level they can check in every 6 months.
So in
right?
this, the complete checkup is not needed.
Yeah,
Only
sometimes we going only for the particular ailments only, for like sugar, for cholesterol, for the heart disease we are doing ECG, 2D echo. Accordingly we can assess the patients and we can prescribe the test accordingly. Okay.
so generally we hear about lifestyle disorders like diabetes, hypertension undergoing checkup. That is,
Yeah.
awareness is there.
Yeah.
But is there any life-threatening disease, something like cancer, can
Yeah,
be
yeah,
diagnosed
yeah,
through
yeah, yeah.
health checkup?
Yeah, health checkup is actually is a complete screening. So we are screened for the cancer also. So for example, chest X-ray. Chest X-ray is the first basic requirement for the any lung cancer in the smokers and all. For female, we can detect breast cancer if family history is there. Just simple mammogram and the ultrasound sonography also we can do for the breast. And yes, ultrasound abdomen will also will help in other pelvic related any cyst, ovarian cyst and all other disorders we can detect before only. Yeah.
Okay. Thank you so much, Dr. Soni.
Yeah.
This information is very useful for our audience.
Yeah.
Audience, we all know our body is the basic tool we have, which God has given us. If we keep it, audience, I hope this information is useful to you and you understand how important it is to get a health checkup done for yourself. A health checkup can diagnose your disease early before it shows any symptoms, and you can treat it early and live a very normal life. It helps in increasing the quality of life and the length of life both. So thank you so much.
Thank you.